Question 1. The assessment process reveals a client who has recently experienced the death of a long-term partner and expresses significant feelings of loneliness and a lack of connection with others outside of the immediate family, who are also struggling with their own grief. The client has mentioned a desire to find ways to re-engage with their community, but feels unsure where to begin. Considering the importance of social support in navigating bereavement, which of the following actions best supports the client's expressed needs and promotes their well-being? Option A. Provide the client with a general brochure on grief and loss, and inform them that they will need to find their own community resources when they feel up to it. Option B. Suggest that the client focus solely on individual grief counseling sessions to process their emotions, as community involvement might be too overwhelming at this stage. Option C. Research and present the client with a curated list of local community organizations, support groups, and volunteer opportunities that align with their stated interests and the nature of their loss, facilitating introductions where appropriate. Option D. Advise the client that feelings of loneliness are a natural and expected part of grief, and encourage them to wait until they feel ready to re-engage socially. The correct answer is C. Research and present the client with a curated list of local community organizations, support groups, and volunteer opportunities that align with their stated interests and the nature of their loss, facilitating introductions where appropriate. Explanation. The assessment process reveals a client experiencing profound grief following the sudden loss of a spouse. The client expresses feelings of isolation and a lack of understanding from their immediate social circle. This scenario is professionally challenging because it requires the thanatologist to not only acknowledge and validate the client's grief, but also to actively facilitate their reconnection with supportive networks, recognizing that grief can be exacerbated by social isolation. The sudden nature of the loss may also mean the client has not had the opportunity to process anticipatory grief, making the immediate aftermath more acute. The correct approach represents best professional practice because it directly addresses the client's expressed need for community support and acknowledges the established role of social connections in mitigating the negative impacts of grief. By identifying and connecting the client with relevant community resources, the thanatologist is acting in accordance with ethical guidelines that promote client well-being and self-sufficiency. This aligns with the principles of holistic care, which consider the social and environmental factors influencing a person's bereavement journey. Furthermore, it empowers the client by providing them with tools and avenues for ongoing support beyond the direct therapeutic relationship. An incorrect approach that involves solely focusing on individual therapeutic interventions without exploring community resources fails to address the client's stated need for connection and may inadvertently reinforce their sense of isolation. This could be seen as a failure to provide comprehensive care and a missed opportunity to leverage external support systems that are often crucial in long-term grief adjustment. Ethically, it may fall short of the duty to explore all reasonable avenues for client support. Another incorrect approach, such as dismissing the client's feelings of isolation as a normal part of grief without offering concrete solutions, is professionally unacceptable. This approach neglects the client's subjective experience and fails to actively assist them in finding coping mechanisms. It can lead to a breakdown in the therapeutic alliance and leave the client feeling unheard and unsupported, potentially exacerbating their distress. This would be a failure to uphold the professional responsibility to provide compassionate and effective care. A further incorrect approach, which involves recommending generic support groups without assessing the client's specific needs or preferences, risks providing an inappropriate or unhelpful resource. While well-intentioned, this approach lacks the personalized care that is essential in grief support. It may lead to the client feeling overwhelmed or alienated if the recommended group does not align with their current stage of grief or specific circumstances, thus failing to optimize the benefit of community resources. The professional decision-making process for similar situations should involve a thorough assessment of the client's current needs, including their social support system and any expressed feelings of isolation. This should be followed by an exploration of available community resources that are relevant to their specific situation and preferences. Collaboration with the client in identifying and accessing these resources is paramount, ensuring that the chosen pathways are empowering and sustainable. The thanatologist's role is to facilitate access and provide guidance, not to dictate solutions, thereby fostering client autonomy and resilience. Question 2. Market research demonstrates that families often have differing opinions and recollections regarding a patient's wishes for end-of-life care when the patient is incapacitated. In such a situation, a healthcare professional is faced with a patient who has lost the capacity to make their own decisions, and there is no clear, legally recognized advance directive or appointed healthcare proxy. A family member, who is not legally designated, strongly advocates for a specific course of action that they believe the patient would have wanted. What is the most appropriate course of action for the healthcare professional to take? Option A. Proceed with the course of action advocated by the family member, as their conviction suggests they likely understand the patient's wishes best. Option B. Delay all medical interventions until a consensus can be reached among all family members, regardless of legal standing. Option C. Consult the jurisdiction's legal framework to identify the legally recognized hierarchy of surrogate decision makers, and proceed with decisions based on the best interests of the patient, as guided by the highest-ranking available surrogate. Option D. Impose the healthcare professional's own ethical or moral judgment on the situation, prioritizing what they believe is the right thing to do for the patient. The correct answer is C. Consult the jurisdiction's legal framework to identify the legally recognized hierarchy of surrogate decision makers, and proceed with decisions based on the best interests of the patient, as guided by the highest-ranking available surrogate. Explanation: this scenario is professionally challenging because it requires navigating the complex intersection of an individual's expressed wishes regarding end-of-life care, the legal framework governing medical decision-making for incapacitated patients, and the ethical obligations of healthcare professionals. The core challenge lies in balancing patient autonomy, even when that autonomy cannot be directly exercised due to incapacity, with the duty to act in the patient's best interest as defined by law and ethical guidelines. The legal framework for end-of-life decisions, particularly when a patient lacks capacity, often relies on established legal documents like advance directives or the appointment of a healthcare proxy. The absence of clear, legally recognized documentation creates a significant risk of misinterpretation or acting outside of legal parameters, potentially leading to legal repercussions and ethical breaches. The correct approach represents best professional practice because it prioritizes adherence to the established legal framework for decision-making when a patient lacks capacity. This involves diligently seeking and verifying the existence of a legally valid advance directive or the appointment of a healthcare proxy. If such documentation exists and is clear, following its directives is legally mandated and ethically sound, as it respects the patient's previously expressed wishes. If no such documentation exists, the legal framework typically outlines a hierarchy of surrogate decision-makers, often starting with a spouse, then adult children, parents and siblings, acting in accordance with this legally defined hierarchy, and making decisions based on what is believed to be in the patient's best interest, often interpreted as what the patient would have wanted, or if that is unknown, what is medically appropriate and beneficial, aligns with both legal requirements and ethical principles of beneficence and non-maleficence. This approach minimizes legal risk and upholds the patient's dignity and rights. An incorrect approach would be to proceed with a significant medical intervention or withdrawal of life-sustaining treatment based solely on the informal or unverified statements of a family member who is not legally designated as a healthcare proxy. This fails to adhere to the legal requirements for surrogate decision-making, which are designed to provide a clear and legally defensible process. Such an action could be considered a violation of the patient's rights and could expose the healthcare provider and institution to legal liability for battery or wrongful death. Another incorrect approach would be to delay necessary care or to impose personal moral or religious beliefs on the patient's care plan, especially if those beliefs conflict with the patient's known or presumed wishes or the established legal framework for decision-making. This constitutes a failure to act in the patient's best interest and can lead to ethical violations related to patient autonomy and professional integrity. The professional decision-making process for similar situations should begin with a thorough understanding of the patient's current capacity status. If capacity is diminished or absent, the immediate next step is to ascertain the existence and validity of any advance directive or healthcare proxy. This requires careful review of the patient's medical record and, if necessary, direct inquiry with family members and legal counsel. If legally recognized documentation exists, it must be followed. If not, professional must consult the relevant jurisdiction's laws to identify the legally recognized hierarchy of surrogate decision makers. Open and compassionate communication with the identified surrogate S is crucial, ensuring they understand their role and the available information. Decisions should then be made collaboratively, always prioritizing the patient's best interests as defined by law and ethical standards, and documenting all steps and discussions meticulously. Question 3. Consider a scenario where a client expresses overwhelming and persistent fear of death, describing it as a constant dread that interferes with their daily life, relationships, and ability to find meaning. The client has explored various spiritual and philosophical perspectives on death, but finds no solace. They are not exhibiting overt signs of a specific mental health disorder that would necessitate immediate psychiatric intervention, but their anxiety is profound and deeply rooted in existential concerns. As a certified in Thanatology professional, what is the most appropriate initial course of action? Option A. Share personal beliefs and experiences regarding death and dying to offer comfort and reassurance to the client, based on the professional's own journey. Option B. Conduct a comprehensive assessment of the client's death anxiety, exploring its origins, manifestations, and impact, while considering their spiritual and existential framework, and engaging in ongoing professional consultation. Option C. Focus solely on providing relaxation techniques and distraction from thoughts of death, aiming to alleviate immediate distress without delving into the underlying causes. Option D. Immediately refer the client to a psychiatrist for evaluation and treatment of potential anxiety disorder, as their symptoms are significantly impacting their daily life. The correct answer is B. Conduct a comprehensive assessment of the client's death anxiety, exploring its origins, manifestations, and impact, while considering their spiritual and existential framework, and engaging in ongoing professional consultation. Explanation. This scenario presents a professional challenge due to the intersection of a client's profound death anxiety with the ethical imperative to provide competent and compassionate care within the framework of professional practice. The challenge lies in distinguishing between a client's existential distress, which is a core concern in thanatology, and potential underlying psychological conditions that may require referral. A skilled thanatologist must navigate this delicate balance, ensuring that interventions are appropriate, evidence-based, and respect the client's autonomy while upholding professional boundaries and competence. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's death anxiety, exploring its origins, manifestations, and impact on their life. This aligns with the ethical guidelines of professional organizations that emphasize thorough client evaluation before implementing interventions. By considering the client's spiritual and existential beliefs, the thanatologist acknowledges the multifaceted nature of death anxiety and its potential connection to deeply held values and meaning-making processes. This approach also demonstrates a commitment to ongoing professional development and consultation, recognizing the limits of one's expertise and the importance of seeking guidance when necessary. This is crucial for ensuring client safety and well-being, and for maintaining professional integrity. An incorrect approach that focuses solely on palliative comfort measures without a thorough assessment of the anxiety's roots would be ethically deficient. It risks oversimplifying a complex issue and failing to address the core distress. This could be seen as a failure to provide adequate care and a potential violation of the duty to competently assess and intervene. Another incorrect approach, such as immediately referring the client to a psychiatrist without exploring the thanatological dimensions of their anxiety, might be premature and could alienate the client by failing to acknowledge the validity of their existential concerns within the scope of thanatology. This could be interpreted as a lack of understanding of the thanatological role and a failure to engage in appropriate initial assessment. A third incorrect approach, involving the imposition of personal beliefs about death and dying, is a clear ethical violation, as it disregards client autonomy and professional neutrality, potentially causing harm and undermining the therapeutic relationship. The professional decision-making process for similar situations should begin with a thorough and empathetic assessment of the client's presenting concerns, specifically focusing on the nature, intensity, and impact of their death anxiety. This assessment should explore the client's personal history, cultural background, spiritual beliefs, and any significant life events that may be contributing to their anxiety. Following this, the thanatologist should consider the most appropriate interventions within their scope of practice, which may include psychoeducation, coping strategies, meaning-centered interventions, or facilitating existential dialogue. If the assessment reveals that the anxiety is significantly impacting the client's functioning or suggests the presence of a co-occurring mental health condition, a referral to an appropriate mental health professional should be considered, but this should be a collaborative process with the client, not an immediate dismissal of their concerns. Throughout this process, ongoing self-reflection, supervision, and consultation with peers are essential to ensure ethical and effective practice. Question 4. The investigation demonstrates a need to critically evaluate the established criteria for determining death. A healthcare team is faced with a patient whose circulatory and respiratory functions have irreversibly ceased. However, due to the patient's participation in an experimental treatment, there is a desire to explore all possible interpretations of death before making a final declaration. Which of the following best reflects the legally and medically accepted definitions of death in most jurisdictions, guiding the professional's decision-making process? Option A. Death is definitively declared by the irreversible cessation of all functions of the entire brain, including the brainstem, or the irreversible cessation of circulatory and respiratory functions. Option B. Death is determined solely by the absence of a heartbeat and respiration, regardless of neurological function. Option C. Death is declared when there is evidence of irreversible cessation of all brain function, even if circulatory and respiratory functions can be artificially maintained. Option D. Death is primarily determined by the family's perception of when the individual is no longer alive, irrespective of medical findings. The correct answer is A. Death is definitively declared by the irreversible cessation of all functions of the entire brain, including the brainstem, or the irreversible cessation of circulatory and respiratory functions. Explanation. This scenario is professionally challenging because the definition of death is not a static, universally agreed-upon concept, and its application has profound legal, ethical, and personal implications. Professionals in thanatology must navigate evolving medical science, diverse cultural beliefs, and legal frameworks to determine when life has ceased. The challenge lies in applying these complex definitions in a way that is both scientifically accurate and ethically sound, respecting the dignity of the deceased and the needs of the bereaved. Careful judgment is required to ensure that decisions are made with integrity and clarity. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the established legal and medical definitions of death within the relevant jurisdiction. This involves recognizing that death can be declared based on irreversible cessation of circulatory and respiratory functions, or irreversible cessation of all functions of the entire brain, including the brainstem. Adhering to these established definitions ensures legal compliance and provides a clear, objective basis for declaring death, which is crucial for subsequent legal and medical procedures, as well as for providing certainty to the bereaved. This approach aligns with the ethical imperative to act with competence and to provide accurate information. An incorrect approach that relies solely on the absence of heartbeat and breathing, without considering the possibility of brain death, fails to acknowledge the full spectrum of legally accepted definitions of death. This could lead to premature or incorrect declarations of death, potentially causing significant distress and legal complications. Ethically, it demonstrates a lack of up-to-date knowledge regarding medical and legal standards. Another incorrect approach that focuses exclusively on the cessation of all brain activity, without considering the irreversible cessation of circulatory and respiratory functions, is also problematic. While brain death is a valid criterion, it is not the only one, and ignoring the traditional cardiopulmonary definition would be an incomplete and potentially erroneous application of the law. This approach could lead to delays in declaring death when cardiopulmonary criteria are clearly met. A further incorrect approach that prioritizes the subjective feelings or beliefs of the family over established medical and legal definitions of death, while empathetic, is ethically and legally unsound. While family wishes are important in end-of-life care, the legal and medical determination of death must be based on objective criteria. Failing to adhere to these criteria can have serious legal ramifications and undermine the integrity of the process. The professional decision-making process for similar situations should involve a thorough review of the patient's condition against the legally recognized criteria for death in the jurisdiction. This includes assessing both cardiopulmonary and neurological functions as appropriate. Consultation with medical colleagues and adherence to institutional protocols are essential. Professionals must remain current with medical advancements and legal interpretations related to the definition of death, ensuring their practice is both compassionate and legally compliant. Question 5. Upon reviewing a patient's chart in hospice care, you note a significant decline in social engagement and a recurring expression of feeling like a burden. The patient has a history of anxiety but has not been formally assessed for psychological distress in the past 6 months. Which of the following represents the most ethically and professionally sound approach to addressing this situation? Option A. Advise the patient's family that the patient is likely experiencing normal end-of-life sadness and that no further intervention is necessary, as this is a common emotional response. Option B. Focus solely on managing the patient's physical symptoms, assuming that addressing pain and discomfort will naturally resolve any underlying psychological issues. Option C. Immediately prescribe an anxiolytic medication to alleviate the patient's perceived distress, based on their history of anxiety without further assessment. Option D. Initiate a comprehensive psychological assessment using a validated instrument designed for end-of-life populations, incorporating a clinical interview to explore the patient's feelings of being a burden and their social withdrawal, while also considering their cultural background and spiritual beliefs. The correct answer is D. Initiate a comprehensive psychological assessment using a validated instrument designed for end-of-life populations, incorporating a clinical interview to explore the patient's feelings of being a burden and their social withdrawal, while also considering their cultural background and spiritual beliefs. Explanation. This scenario presents a professional challenge due to the inherent complexity of assessing psychological distress in individuals facing end-of-life. The delicate balance between respecting patient autonomy, providing compassionate care, and adhering to professional ethical guidelines requires careful judgment. The goal is to identify and address psychological needs without imposing personal beliefs or causing undue distress. The correct approach prioritizes a comprehensive, individualized assessment that utilizes validated tools and considers the patient's unique context, including their cultural background, spiritual beliefs, and existing support systems. This aligns with the ethical imperative to provide patient-centered care, ensuring that interventions are tailored to the individual's needs and preferences. Professional guidelines in thanatology emphasize the importance of a holistic approach, recognizing that psychological well-being is intrinsically linked to physical and spiritual health. This approach respects the patient's dignity and promotes their quality of life during a vulnerable period. An incorrect approach would be to rely solely on anecdotal observations or generalized assumptions about end-of-life distress. This fails to acknowledge the diversity of human experience and can lead to misdiagnosis or inappropriate interventions. Such an approach may also violate ethical principles of beneficence and non-maleficence by potentially causing harm through misjudgment or neglect of specific needs. Another incorrect approach would be to administer a standardized psychological assessment without considering the patient's current physical and emotional state, potentially causing further distress or anxiety. This disregards the need for sensitivity and adaptation in assessment practices within end-of-life care. Professionals should employ a decision-making framework that begins with recognizing the signs of potential psychological distress. This is followed by a thorough, yet sensitive, assessment process that may involve a combination of clinical interviews, validated psychometric tools, and consultation with other members of the interdisciplinary care team. Crucially, the patient's consent and active participation should be sought throughout the process, respecting their right to self-determination. The assessment should inform a collaborative care plan that addresses identified psychological needs, with ongoing evaluation and adjustment as necessary. Question 6. System analysis indicates that a client, whose family has recently experienced a death, expresses a strong desire to incorporate specific, traditional mourning rituals that are not part of the bereavement service's standard offerings. These rituals involve prolonged periods of communal lamentation and specific symbolic offerings that differ significantly from the service's typical memorialization practices. The bereavement counselor is aware that accommodating these rituals may require significant adjustments to scheduling and resource allocation, and could potentially be perceived as unusual by other clients or staff. What is the most ethically sound and professionally appropriate course of action for the bereavement counselor? Option A. Gently explain to the client that their requested rituals are not aligned with the service's established practices and are considered unconventional, and then proceed with the standard memorialization process. Option B. Lightly inform the client that the bereavement service operates under strict protocols and cannot deviate from its standard memorialization practices, suggesting they seek external support if their cultural needs cannot be met. Option C. Engage in a collaborative discussion with the client to understand the cultural and personal significance of their requested rituals. Explore potential ways to adapt or integrate them within the service's capabilities, or offer alternative support that honors the spirit of their traditions. Option D. Agree to the client's requests without fully understanding their cultural context, hoping to avoid conflict, even if it means compromising the service's established procedures and potentially creating logistical challenges. The correct answer is C. Engage in a collaborative discussion with the client to understand the cultural and personal significance of their requested rituals. Explore potential ways to adapt or integrate them within the service's capabilities, or offer alternative support that honors the spirit of their traditions. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's deeply ingrained cultural beliefs about death rituals and the practical, often standardized, procedures of a bereavement service. The professional must navigate this delicate balance with sensitivity, respect, and adherence to ethical guidelines that prioritize client autonomy and cultural humility. The challenge lies in ensuring that the client feels heard, understood, and supported in their grief process, without imposing external norms or dismissing their cultural identity. The correct approach represents best professional practice because it prioritizes a client-centered and culturally responsive model of care. This involves actively listening to the client's needs, understanding the cultural significance of their requested rituals, and seeking to integrate them into the service provided, or at least offering alternatives that honor the spirit of their traditions. This aligns with ethical principles of respect for diversity, non-maleficence, avoiding harm by invalidating their beliefs, and beneficence, acting in the client's best interest by supporting their grieving process in a culturally congruent way. It also reflects a commitment to professional development in understanding diverse cultural perspectives on death and dying. An incorrect approach that dismisses the client's cultural practices as unusual or difficult represents a significant ethical failure. This demonstrates a lack of cultural competence and can lead to feelings of alienation, disrespect, and invalidation for the client, potentially hindering their grieving process. It violates the ethical imperative to provide services that are sensitive to the diverse needs of clients and can be perceived as discriminatory. Another incorrect approach, which is to rigidly adhere to the service's standard procedures without any attempt to accommodate the client's cultural requests, also constitutes an ethical failure. While procedural consistency is important, it should not override the fundamental ethical obligation to provide compassionate and individualized care. This approach fails to recognize that grief is a culturally mediated experience and can cause distress by forcing the client to conform to norms that are not their own. A third incorrect approach, which is to offer a superficial or tokenistic acknowledgement of the cultural practices without genuine understanding or effort to integrate them, is also ethically problematic. This can be perceived as patronizing and insincere, further alienating the client. It fails to demonstrate the depth of respect and understanding required for effective bereavement support. The professional decision-making process for similar situations should involve a framework of cultural humility. This includes self-reflection on one's own biases and assumptions, active listening and open-ended questioning to understand the client's perspective, and a willingness to learn about and adapt to different cultural practices. Professionals should consult relevant ethical codes and guidelines that emphasize cultural sensitivity and client-centered care. When faced with unfamiliar cultural practices, seeking guidance from cultural liaisons or community elders, where appropriate and with client consent, can be invaluable. The ultimate goal is to provide support that is both effective and respectful of the client's unique cultural and personal journey through grief. Question 7. Examination of the data shows a family from a culture with distinct ancestral veneration practices following the death of a grandparent. The family expresses a strong desire to continue these practices, which involve specific rituals and the preservation of certain personal items of the deceased. The thanatologist is familiar with common Western mourning practices, but not with this specific ancestral veneration tradition. What is the most ethically sound and culturally competent approach for the thanatologist to adopt? Option A. Proceed with standard bereavement counseling and memorial services, assuming that the family will eventually adapt to more conventional approaches as their grief progresses. Option B. Express unfamiliarity with their practices and advise the family to seek guidance from a cultural or religious leader who is more knowledgeable about their specific traditions. Without offering direct support, Option C. Gently suggests that, while their traditions are noted, it would be more beneficial for the family to focus on more widely recognized grief support strategies and memorialization practices. Option D. Engage in open dialogue with the family to understand the specific nature and significance of their ancestral veneration practices, asking clarifying questions to learn how to best support their traditions and integrate them into the bereavement process. The correct answer is D. Engage in open dialogue with the family to understand the specific nature and significance of their ancestral veneration practices, asking clarifying questions to learn how to best support their traditions and integrate them into the bereavement process. Explanation. This scenario is professionally challenging because it requires a thanatologist to navigate deeply held, diverse cultural beliefs and practices surrounding death and bereavement without imposing their own cultural norms or making assumptions. The core challenge lies in providing sensitive, respectful, and effective support that acknowledges and honors the unique cultural framework of the bereaved family. This requires a high degree of cultural humility, active listening, and a commitment to understanding rather than judging. The correct approach represents best professional practice because it prioritizes the client's cultural context and actively seeks to understand and integrate their specific practices. This aligns with ethical guidelines in thanatology that emphasize client-centered care, respect for autonomy, and cultural competence. By engaging in open dialogue, asking clarifying questions, and demonstrating a willingness to learn, the thanatologist builds trust and ensures that the support provided is genuinely helpful and culturally appropriate, thereby avoiding potential harm or offense. An incorrect approach that assumes a universal grieving process or imposes westernized mourning rituals would be a significant ethical failure. This demonstrates a lack of cultural competence and can alienate the bereaved family, making them feel misunderstood or disrespected. It violates the principle of client autonomy by failing to acknowledge their right to grieve and memorialize in ways that are meaningful to them. Another incorrect approach, such as dismissing or minimizing the importance of specific cultural practices due to unfamiliarity, would also be an ethical breach, indicating a lack of professional curiosity and a failure to uphold the dignity of the deceased and their family. The professional decision-making process for similar situations should involve a commitment to ongoing learning and self-reflection regarding cultural biases. When encountering diverse cultural practices, the professional should adopt a stance of curiosity and respect, initiating conversations with open-ended questions to understand the family's beliefs, rituals, and expectations. This involves active listening, non-judgmental observation, and a willingness to adapt one's approach to align with the family's cultural framework, always prioritizing their comfort and needs. Question 8. Performance analysis shows that a thanatologist is developing a new bereavement support program. They are considering incorporating elements from historical approaches to mourning rituals and societal attitudes towards death, as observed in 18th century European societies, into the program's framework. Which of the following approaches best aligns with current professional standards and regulatory compliance for thanatologists? Option A. Selectively incorporating aspects of 18th century mourning rituals and societal attitudes that are perceived as beneficial, without a systematic review of their ethical implications or their compatibility with current legal frameworks, to add a unique historical dimension to the program. Option B. Implementing 18th century mourning rituals and societal attitudes directly into the program, as they represent a foundational understanding of historical grief responses, without significant modification, to offer a more authentic historical experience. Option C. Integrating historical mourning rituals and societal attitudes from the 18th century into the program, ensuring they are adapted to align with contemporary ethical principles of autonomy, informed consent, and non-maleficence, and are compliant with all current legal statutes governing bereavement services. Option D. Disregarding all historical perspectives on death and mourning, including 18th century practices, and focusing solely on the most recent research and evidence-based practices in modern thanatology to ensure absolute adherence to current standards. The correct answer is C. Integrating historical mourning rituals and societal attitudes from the 18th century into the program, ensuring they are adapted to align with contemporary ethical principles of autonomy, informed consent, and non-maleficence, and are compliant with all current legal statutes governing bereavement services. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a thanatologist to navigate the complex interplay between evolving societal views on death and dying, and the established ethical and legal frameworks that govern end-of-life care and bereavement support. The challenge lies in applying historical understanding to contemporary practice without compromising current professional standards or regulatory compliance. A deep understanding of historical perspectives is crucial for contextualizing current practices and anticipating future shifts, but it must be grounded in the present regulatory environment. Correct approach analysis. The correct approach demonstrates best professional practice by acknowledging the influence of historical perspectives on contemporary thanatology while strictly adhering to the current regulatory framework and ethical guidelines. This approach recognizes that, while historical understanding enriches practice, it does not supersede the legal and ethical mandates of the present. It emphasizes the importance of evidence-based practice informed by historical context, but ultimately guided by current professional standards and legal requirements. This aligns with the principle of providing competent and ethical care within the established legal and professional boundaries. Incorrect approaches analysis. An approach that prioritizes historical practices over current regulations would be a significant ethical and regulatory failure. It risks violating patient rights, legal statutes governing end-of-life care, and professional codes of conduct. For instance, if historical practices involved less emphasis on patient autonomy or consent, applying them today would contravene modern legal and ethical principles. An approach that dismisses historical perspectives entirely as irrelevant to modern practice would also be a failure. While current regulations are paramount, understanding historical shifts in attitudes towards death can provide valuable insights into the evolution of care, the development of ethical considerations, and the roots of current practices. Ignoring this context can lead to a less nuanced and potentially less effective approach to bereavement support and end-of-life care. An approach that selectively applies historical perspectives without a clear rationale or without ensuring alignment with current ethical and legal standards is also problematic. This can lead to inconsistent or biased application of knowledge, potentially disadvantaging individuals or families by not providing care that is both historically informed and ethically sound according to current mandates. Professional reasoning. Professionals should approach situations requiring the integration of historical perspectives with current practice by first thoroughly understanding the applicable regulatory framework and ethical guidelines. This forms the bedrock of all professional actions. Next, they should critically evaluate historical perspectives, identifying their relevance and potential insights without allowing them to override current mandates. The decision-making process should involve a continuous assessment of how historical understanding can inform, but not dictate, practice within the bounds of current legal and ethical requirements. This ensures that care is both compassionate, informed, and compliant. Question 9. Quality control measures reveal that a thanatologist is presenting grief support workshops. During a recent session, the practitioner stated, all individuals experiencing loss must progress through denial, anger, bargaining, depression, and finally acceptance in that specific order to achieve healthy bereavement. This statement has raised concerns regarding the practitioner's adherence to best practices in thanatology. Which of the following best describes the professional challenge and the most appropriate approach to grief models in this context? Option A. The practitioner's rigid adherence to a linear stage model of grief, failing to acknowledge the fluid and individual nature of bereavement, is a significant professional challenge. Best practice involves utilizing grief models as flexible frameworks to understand potential reactions, rather than prescriptive pathways, always prioritizing the client's unique experience and pace. Option B. The practitioner's statement reflects a common misunderstanding of grief, but it is not a significant professional challenge, as all clients eventually experience these emotions. Best practice involves educating clients about the stages of grief to provide them with a roadmap for their recovery. Option C. The practitioner's approach is problematic because it dismisses the importance of theoretical models in understanding grief. Best practice involves relying solely on the client's subjective experience without the guidance of established grief theories. Option D. The practitioner's focus on the stages of grief is commendable as it provides a clear structure for clients. Best practice involves ensuring clients understand and attempt to move through each stage systematically to achieve resolution. The correct answer is A. The practitioner's rigid adherence to a linear stage model of grief, failing to acknowledge the fluid and individual nature of bereavement, is a significant professional challenge. Best practice involves utilizing grief models as flexible frameworks to understand potential reactions, rather than prescriptive pathways, always prioritizing the client's unique experience and pace. Explanation. Scenario analysis. This scenario presents a common challenge in thanatology, where a practitioner must apply theoretical models of grief to a complex individual experience. The challenge lies in recognizing that grief is not a linear or universally applicable process, and that rigidly adhering to a single model can be detrimental to client care. Professionals must exercise nuanced judgment, balancing theoretical understanding with empathetic responsiveness to the client's unique journey. Correct approach analysis. The correct approach emphasizes the adaptive and individual nature of grief, acknowledging that while models like Kubler-Ross and Worden offer valuable frameworks for understanding common grief reactions, they are not prescriptive checklists. Best professional practice involves using these models as guides to identify potential areas of distress or unmet needs, but always prioritizing the client's subjective experience and tailoring interventions accordingly. This aligns with ethical guidelines that mandate client-centered care, respect for individual autonomy, and the avoidance of imposing external expectations on the grieving process. The focus is on facilitating the client's own unique path through grief, rather than attempting to fit them into a predefined structure. Incorrect approaches analysis. An approach that strictly applies the stages of Kubler-Ross as a sequential and mandatory path for all bereaved individuals is ethically flawed. It fails to acknowledge the non-linear, cyclical, and often simultaneous experience of grief, potentially invalidating the client's feelings if they do not progress through the stages in the prescribed order. This can lead to misdiagnosis of complicated grief or pressure on the client to conform to an artificial timeline, violating principles of client autonomy and respect for individual experience. An approach that dismisses all theoretical models of grief as irrelevant or unhelpful is also professionally deficient. While acknowledging the limitations of models, completely disregarding them means losing valuable insights into common patterns of grief, potential risk factors, and effective intervention strategies. This can lead to a less informed and potentially less effective practice, failing to leverage established knowledge to support clients. It may also be seen as a failure to maintain professional competence by not engaging with the foundational literature of the field. An approach that solely focuses on the tasks of mourning, as outlined by Worden, without considering the emotional and psychological impact of the loss on the individual, is incomplete. While Worden's tasks are crucial, they are best addressed within the context of the individual's emotional state and their capacity to engage with these tasks. Ignoring the emotional landscape can lead to a superficial engagement with the tasks, failing to address the deeper needs of the bereaved. This can be seen as a failure to provide holistic care, which is a cornerstone of ethical practice. Professional reasoning. Professionals should adopt a flexible and integrative approach to grief models. This involves 1. Understanding the theoretical underpinnings of various models, e.g., Kubler-Ross, Worden, Strobe, and Schutt's dual-process model, to gain a broad perspective on grief phenomena. 2. Continuously assessing the client's individual experience, paying close attention to their unique emotional responses, coping mechanisms, and cultural context. 3. Using models as diagnostic and intervention planning tools, identifying potential areas of difficulty or strength, but remaining open to the client's deviation from typical patterns. 4. Prioritizing empathy, validation, and the establishment of a strong therapeutic alliance, which are essential for effective support regardless of the theoretical framework employed. 5. Regularly engaging in self-reflection and seeking supervision to ensure practice remains client-centered and ethically sound. Question 10. Analysis of the manifestations of complicated grief in a bereaved client requires a professional to differentiate between prolonged but adaptive grieving and a pathological response. Which of the following approaches best reflects a professional's responsibility in assessing for complicated grief, considering the ethical imperative to support client well-being and recognize when specialized intervention may be necessary? Option A. Focusing solely on the absence of suicidal ideation as the primary indicator of successful grief resolution. Option B. A comprehensive assessment that evaluates the duration, intensity, and functional impact of grief symptoms, alongside the client's coping strategies and social support, to identify potential indicators of complicated grief. Option C. Dismissing the client's expressions of intense sadness or avoidance as simply part of the natural grieving process without further investigation. Option D. A determination that grief is normal if it persists for more than 1 year, regardless of the client's subjective experience or functional impairment. Correct answer is B. A comprehensive assessment that evaluates the duration, intensity, and functional impact of grief symptoms, alongside the client's coping strategies and social support, to identify potential indicators of complicated grief. Explanation. This scenario is professionally challenging because differentiating between normal, albeit prolonged, grief and complicated grief requires a nuanced understanding of individual responses to loss, cultural factors, and the absence of clear-cut diagnostic timelines in the immediate aftermath of a death. Professionals must balance empathy and support with the need to identify potential pathological grief reactions that may require specialized intervention. The regulatory framework for thanatology, while not explicitly dictating diagnostic criteria for complicated grief in the same way as medical diagnoses, emphasizes ethical practice, client well-being, and the professional's responsibility to recognize when a client's distress may exceed typical bereavement responses and warrants further assessment or referral. The correct approach represents best professional practice because it involves a comprehensive assessment that considers the duration, intensity, and functional impairment of the bereaved individual's grief symptoms, alongside their coping mechanisms and social support. This aligns with ethical guidelines that prioritize client welfare and the professional's duty of care. By observing for specific indicators such as persistent avoidance of reminders of the deceased, intense longing, difficulty accepting the death, and significant impairment in daily functioning, the professional is acting responsibly to identify potential complicated grief. This proactive stance allows for timely intervention, which can significantly improve outcomes for the bereaved. An incorrect approach that focuses solely on the passage of time, without considering the qualitative nature of the grief symptoms, is professionally unacceptable. Grief is not a linear process, and imposing arbitrary time limits for its resolution can be dismissive of the individual's experience and may lead to the underrecognition of complicated grief. This fails to meet the ethical obligation to provide individualized care and support. Another incorrect approach that dismisses the bereaved individual's distress as simply normal grief without a thorough assessment is also ethically problematic. This can lead to a failure to identify and address complicated grief, potentially prolonging the individual's suffering and hindering their ability to adapt to their loss. It neglects the professional's responsibility to recognize and respond to signs of significant psychological distress. The professional decision-making process for similar situations should involve a continuous assessment cycle. This includes active listening to the client's narrative, observing their emotional and behavioral responses, and comparing these observations against established understandings of grief processes, while remaining sensitive to individual and cultural variations. When signs of prolonged, intense, or functionally impairing grief are present, the professional should consider the possibility of complicated grief and explore further assessment, psychoeducation, and if necessary, referral to specialized mental health services. This iterative process ensures that care remains client-centered and ethically sound. Question 11. The control framework reveals that a thanatologist is providing support to a family whose cultural background emphasizes communal grieving rituals, including extended periods of visitation, specific mourning attire, and the preparation of symbolic foods, all of which are integral to their healing process. The family expresses a desire to maintain these traditions fully, even if they differ from the thanatologist's own cultural understanding of grief. Which of the following represents the most ethically sound and professionally appropriate course of action for the thanatologist? Option A. Actively participate in and facilitate the family's cultural grieving rituals, offering support and understanding within their framework, while also ensuring the family is aware of available resources that align with their practices. Option B. Express concern about the potential for prolonged emotional distress due to the intensity of their communal rituals, and recommend a more structured, time-limited approach to mourning. Option C. Inform the family that while their traditions are noted, the thanatologist will proceed with a standardized grief support program that has proven effective across diverse populations. Option D. Gently suggest that some of the family's rituals might be overly burdensome and propose incorporating more individualized, less public expressions of grief that are common in Western cultures. The correct answer is A. Actively participate in and facilitate the family's cultural grieving rituals, offering support and understanding within their framework, while also ensuring the family is aware of available resources that align with their practices. Explanation. This scenario is professionally challenging because it requires a thanatologist to navigate deeply ingrained cultural beliefs about death and mourning, which can significantly differ from their own or the dominant cultural norms. The core challenge lies in providing sensitive and effective support without imposing personal or westernized views on grief. Careful judgment is required to balance the client's cultural practices with the professional's ethical obligations to provide competent and respectful care. The correct approach represents best professional practice because it prioritizes client autonomy and cultural humility. By actively seeking to understand and respect the family's specific cultural practices, the thanatologist demonstrates a commitment to person-centered care. This aligns with ethical guidelines that emphasize respecting diversity and avoiding cultural imposition. The professional's role is to facilitate the grieving process according to the client's cultural framework, not to alter it. This approach fosters trust and ensures the family feels understood and supported in a way that is meaningful to them. An incorrect approach that involves gently suggesting alternative grieving practices based on common Western models would represent a significant ethical failure. This demonstrates a lack of cultural competence and a failure to respect the client's autonomy. It implies that the client's cultural practices are somehow deficient or less valid, which is discriminatory and harmful. Ethically, this violates the principle of non-maleficence by potentially causing distress and undermining the family's coping mechanisms. Another incorrect approach, such as dismissing the family's rituals as unnecessary or superstitious, and proceeding with a standardized grief support model, is a profound ethical and professional failing. This exhibits extreme cultural insensitivity and disrespect, directly contradicting the core tenets of compassionate care. It would likely alienate the family, cause them significant emotional pain, and prevent any possibility of effective support. This approach demonstrates a complete disregard for the client's cultural identity and their right to grieve in a manner consistent with their beliefs. A professional decision-making process for similar situations should begin with a commitment to cultural humility. This involves acknowledging one's own cultural biases and limitations. The next step is active listening and open-ended inquiry to understand the client's cultural background and their specific beliefs and practices surrounding death and grief. The professional should then integrate this understanding into their support plan, adapting their interventions to be culturally congruent. If there are any practices that raise genuine safety or ethical concerns, which is rare in grief rituals themselves, but could arise in related contexts, the professional should address these with sensitivity and in collaboration with the client, always prioritizing their well-being and cultural integrity. Question 12. Risk assessment procedures indicate that a terminally ill patient who has consistently expressed a desire to refuse further aggressive medical interventions, is now being strongly urged by their family to reconsider and accept a new experimental treatment. The patient appears withdrawn and has not directly communicated their wishes regarding this specific treatment to the healthcare team in the last 24 hours. What is the most appropriate immediate course of action for the healthcare professional? Option A. Inform the family that the patient's previously expressed wishes are legally binding and that their current pressure is inappropriate, without directly speaking to the patient about their current feelings. Option B. Directly engage the patient in a private conversation to ascertain their current understanding of their prognosis, the proposed experimental treatment, and their wishes regarding it, while also assessing their capacity to make this decision. Option C. Defer to the family's expressed concerns and initiate discussions with the medical team about the feasibility and potential benefits of the experimental treatment, assuming the patient's withdrawal signifies a change of heart. Option D. Immediately consult with the hospital's ethics committee to determine the best course of action, given the family's strong advocacy for the experimental treatment and the patient's apparent reticence. The correct answer is B. Directly engage the patient in a private conversation to ascertain their current understanding of their prognosis, the proposed experimental treatment, and their wishes regarding it, while also assessing their capacity to make this decision. Explanation. This scenario presents a profound professional challenge due to the inherent tension between respecting a patient's expressed wishes and the potential for external influences or perceived vulnerabilities to impact the voluntariness and informed nature of their decision-making. The professional's role is to navigate this complex ethical landscape, ensuring that the patient's autonomy is upheld while also safeguarding against coercion or undue influence. Careful judgment is required to distinguish between genuine patient preference and decisions that may be compromised. The correct approach prioritizes direct, unmediated communication with the patient, seeking to understand the underlying reasons for their decision and confirming their capacity to make it. This aligns with the fundamental ethical principle of patient autonomy, which is paramount in end-of-life care. Regulatory frameworks and ethical guidelines consistently emphasize the right of competent individuals to make informed decisions about their medical treatment, including decisions to refuse or withdraw life-sustaining interventions. This approach ensures that the patient's voice is central and that their decision is respected as an expression of their values and preferences, provided they have the capacity to make such a decision. An incorrect approach that relies solely on the family's interpretation of the patient's wishes fails to uphold the principle of patient autonomy. The family's perspective, while potentially well-intentioned, is not a substitute for the patient's own expressed will. This approach risks overriding the patient's fundamental right to self-determination and could lead to a violation of their wishes, constituting an ethical and potentially regulatory failure. Another incorrect approach that involves delaying the process to gather more information without directly engaging the patient in a discussion about their decision-making capacity or the rationale behind their wishes can also be problematic. While information gathering is important, if it becomes a means to circumvent or question the patient's autonomy without a clear, evidence-based concern about their capacity, it can be seen as a subtle form of paternalism or a failure to act promptly on a patient's expressed wishes. This can lead to distress for the patient and their family, and may not align with the ethical imperative to respect a competent patient's decisions in a timely manner. A further incorrect approach that involves seeking external validation of the patient decision without first establishing the patient's capacity and understanding their reasoning can also be a misstep. While consultation with colleagues or ethics committees can be valuable in complex cases, it should not be a substitute for the primary responsibility of the treating professional to assess the patient's capacity and understand their wishes directly. This can lead to unnecessary delays and can undermine the patient's sense of agency. The professional decision-making process for similar situations should involve a structured approach. First, assess the patient's capacity to make the decision. This involves evaluating their ability to understand the relevant information, appreciate the consequences of their decision, and communicate their choice. Second, engage in open and honest communication with the patient to understand their values, beliefs, and the reasons behind their end-of-life decision. Third, involve the patient's family or support system as appropriate, with the patient's consent, to ensure they are informed and to facilitate communication, but always prioritizing the patient's expressed wishes. Fourth, document all assessments, discussions, and decisions thoroughly. If there are significant concerns about capacity or undue influence, consult with relevant specialists or ethics committees, but always with the patient's best interests and autonomy at the forefront. Question 13. Research into the application of theoretical models of grief and bereavement in practice has led to a debate among professionals regarding the most effective approach to supporting individuals experiencing loss. Considering the current understanding within the field, which of the following reflects the most ethically sound and professionally recommended approach for a certified in Thanatology practitioner? Option A. Dismissing all theoretical models of grief as overly academic and irrelevant to the practical realities of supporting bereaved individuals. Option B. Employing a flexible, integrative approach that draws upon multiple theoretical perspectives to inform understanding and practice, while prioritizing the individual's unique experience and needs. Option C. Prioritizing a theoretical model that aligns with the practitioner's personal beliefs about how grief should be experienced, regardless of the bereaved individual's expressed feelings. Option D. Strictly adhering to a single, well-established stage-based model of grief, guiding the bereaved through each defined phase in a sequential manner. The correct answer is B. Employing a flexible, integrative approach that draws upon multiple theoretical perspectives to inform understanding and practice, while prioritizing the individual's unique experience and needs. Explanation. This scenario is professionally challenging because it requires a thanatologist to apply theoretical frameworks of grief to a real-life situation while adhering to professional ethical standards and potentially relevant, though not explicitly stated for this exam's jurisdiction, general principles of care. The complexity arises from the subjective nature of grief and the need to avoid imposing a single theoretical model as universally applicable. Careful judgment is required to recognize that individuals experience grief uniquely and that a rigid adherence to one theory can be detrimental to providing sensitive and effective support. The correct approach represents best professional practice because it acknowledges the multifaceted nature of grief and the limitations of any single theoretical model. It emphasizes a client-centered approach, integrating insights from various theories to inform understanding and practice without being dogmatic. This aligns with ethical principles of respecting individual autonomy and tailoring support to the specific needs of the bereaved. While this exam's jurisdiction does not specify particular laws for thanatology practice, the underlying ethical imperative to provide competent and compassionate care, informed by current knowledge, is paramount. An incorrect approach that rigidly applies a single, linear stage model of grief, e.g., Kubler-Ross's stages without acknowledging their evolution or limitations, fails to recognize the non-linear, individualized, and often cyclical nature of grief. This can lead to pathologizing normal grief reactions that do not fit the prescribed stages, potentially causing distress to the bereaved and undermining their coping processes. Ethically, this approach disrespects the unique experience of the individual and can be seen as a failure to provide competent care by misinterpreting or misapplying theoretical knowledge. Another incorrect approach that dismisses all theoretical frameworks as irrelevant to practice would be professionally unsound. While acknowledging the limitations of theories is important, completely disregarding them means abandoning a valuable body of knowledge that can inform understanding of common grief responses, potential complications, and effective interventions. This could lead to a reactive rather than a proactive approach to supporting the bereaved, potentially missing opportunities to offer appropriate guidance or identify when specialized support might be needed. This represents a failure to engage with the professional knowledge base expected of a certified practitioner. A third incorrect approach might involve prioritizing a specific theoretical model based on personal preference or anecdotal evidence rather than a comprehensive understanding of the literature and the client's needs. This is ethically problematic as it introduces bias and can lead to a suboptimal or even harmful intervention strategy. Professional decision-making in this context should involve a critical evaluation of various theoretical perspectives on grief and bereavement, understanding their strengths and weaknesses, and then applying this knowledge flexibly and compassionately to the unique circumstances of each individual. The process involves active listening, empathetic engagement, and a continuous assessment of the bereaved person's experience, using theoretical frameworks as guides rather than rigid prescriptions. Question 14. The audit findings indicate that a bereavement support service is struggling to effectively guide clients through their grief journeys, with some clients reporting feeling pressured to move on prematurely, while others feel stuck in their sorrow. A review of case notes suggests a lack of consistent theoretical application. Considering the dual process model of coping with loss, which of the following approaches best reflects a professional and ethically sound practice for supporting a bereaved individual? Option A. Facilitating the bereaved individual's oscillation between confronting the pain of their loss and engaging in new life roles and activities, while validating both processes. Option B. Suggesting that the bereaved individual suppress their feelings of loss to appear strong and resilient to others. Option C. Encouraging the bereaved individual to immediately focus on rebuilding their life and engaging in new social activities to distract from their pain. Option D, primarily focusing on the emotional pain of the loss, ensuring the individual fully processes every aspect of their grief before considering any future engagement. The correct answer is A, facilitating the bereaved individual's oscillation between confronting the pain of their loss and engaging in new life roles and activities, while validating both processes. Explanation: the audit findings indicate a need to assess the application of the dual process model of coping with loss within a bereavement support service. This scenario is professionally challenging because it requires practitioners to navigate the complex emotional landscape of grief while adhering to established theoretical frameworks and ethical guidelines for providing support. The dual process model, which posits oscillation between loss-oriented and restoration-oriented coping, offers a nuanced understanding of grief, but its practical application demands sensitivity and individualized assessment. The correct approach involves recognizing that effective bereavement support is not about forcing a client to move on from their loss, but rather facilitating their oscillation between confronting the pain of loss and engaging in new life roles and activities. This approach aligns with best professional practice by respecting the client's unique grief journey, acknowledging the validity of both loss-oriented and restoration-oriented processes, and empowering them to find their own balance. This is ethically sound as it prioritizes client autonomy and well-being, avoiding premature or directive interventions that could be detrimental. An incorrect approach would be to solely focus on encouraging the bereaved individual to get over their loss and immediately engage in new activities, neglecting the necessary process of confronting and processing the pain of the bereavement. This fails to acknowledge the importance of loss-oriented coping and can lead to unresolved grief, emotional distress, and a sense of invalidation for the bereaved. Ethically, this approach could be seen as imposing external expectations rather than supporting the individual's internal process, potentially causing harm. Another incorrect approach would be to exclusively focus on the emotional pain of the loss, discouraging any attempts at restoration or engagement with life outside of the grief. This can trap individuals in a state of prolonged mourning, hindering their ability to adapt and find meaning in their changed circumstances. This approach is ethically problematic as it can prevent the individual from developing adaptive coping mechanisms and finding a path towards a fulfilling life post-loss. Professionals should approach such situations by first conducting a thorough assessment of the individual's current coping strategies, their emotional state, and their capacity for engagement. They should then introduce the principles of the dual process model as a framework for understanding their experience, rather than as a prescriptive set of steps. The professional's role is to facilitate the client's exploration of both loss-oriented and restoration-oriented activities, offering support and validation for their oscillations, and helping them to integrate these experiences into a new sense of self and life. Decision-making should be guided by a client-centered ethos, prioritizing the individual's pace and needs, and consistently referencing ethical codes that emphasize beneficence, non-maleficence, and respect for autonomy. Question 15. Cost-benefit analysis shows that investing in specialized, age-appropriate grief support programs for children and adolescents experiencing parental loss yields significant long-term benefits in terms of reduced mental health issues and improved social functioning. However, a community bereavement service is considering a standardized, generic grief support model for all age groups due to budget constraints. Which of the following approaches best reflects a professional and ethical response to this situation, considering the principles of grief across the lifespan? Option A. Focus solely on immediate crisis intervention for all age groups, assuming that longer-term grief processing can be managed by other community resources or the individuals themselves. Option B. Implement the generic model to ensure some level of support is available to all, as any support is better than none, and address specific needs on a case-by-case basis if resources allow. Option C. Prioritize support for adults, as they are typically the primary caregivers and decision-makers, and their grief is often more complex and impactful on the family unit. Option D. Advocate for increased funding by presenting data on the long-term cost savings of age-specific interventions, emphasizing the ethical imperative to provide developmentally appropriate care. The correct answer is D. Advocate for increased funding by presenting data on the long-term cost savings of age-specific interventions, emphasizing the ethical imperative to provide developmentally appropriate care. Explanation: This scenario is professionally challenging because it requires a nuanced understanding of grief as a dynamic process that evolves across the lifespan, rather than a static event. Professionals must recognize that interventions appropriate for one age group may be ineffective or even harmful for another. The challenge lies in tailoring support to the unique cognitive, emotional, and social developmental stages of individuals experiencing loss. Careful judgment is required to avoid a one-size-fits-all approach, which can lead to misinterpretation of grief responses and inadequate support. The correct approach represents best professional practice because it prioritizes individualized, developmentally appropriate grief support. This aligns with ethical guidelines in thanatology, which emphasize client-centered care and the recognition of diverse grief experiences. By considering the specific developmental stage of the child, adolescent, or older adult, professionals can select interventions that are most likely to be effective and promote healthy adaptation to loss. This approach respects the autonomy and unique needs of each individual, fostering a therapeutic relationship built on understanding and trust. It also implicitly acknowledges the potential for different cultural and societal influences on grief expression at various life stages, further enhancing its ethical grounding. An incorrect approach that fails to consider developmental stages would be ethically problematic. For instance, applying adult grief counseling techniques directly to a young child without adaptation could lead to confusion, anxiety, and a failure to address their specific needs for concrete explanations and play-based processing. This would violate the ethical principle of beneficence by not acting in the best interest of the child. Similarly, assuming that an older adult's grief is simply a continuation of past losses, without acknowledging potential new challenges like social isolation or physical decline, would be a failure of non-maleficence, potentially leading to ineffective support and exacerbating distress. Another incorrect approach might be to dismiss or minimize the grief of an adolescent, viewing it as a temporary phase of emotional volatility, thereby failing to provide necessary validation and support, which is a breach of professional responsibility. The professional decision-making process for similar situations should involve a thorough assessment of the individual's developmental stage, cognitive abilities, emotional maturity, and the specific nature of their loss. This assessment should inform the selection of appropriate theoretical frameworks and intervention strategies. Professionals should remain open to ongoing evaluation of the effectiveness of their support and be prepared to adapt their approach as the individual's grief evolves. Consultation with colleagues and supervisors, as well as ongoing professional development in thanatology and developmental psychology, are crucial for maintaining competence and ethical practice. Question 16. Which approach would be most appropriate for a thanatologist when a family member presents a deceased individual's previously expressed wishes for disposition, but other family members present express conflicting desires and there is no formal written directive? Option A. Seek verifiable documentation of the deceased's wishes, engage in facilitated communication with all involved family members, and consult legal counsel if significant legal ambiguity or conflict persists regarding disposition authority and the weight of prior verbal expressions. Option B. Prioritize the wishes of the family member who is most actively involved in the funeral arrangements, assuming they have the deceased's best interests at heart. Option C. Inform the family that without a formal written directive, the deceased's prior verbal wishes cannot be legally honored and proceed according to standard legal protocols for unclaimed or disputed remains. Option D. Immediately proceed with the disposition that aligns with the wishes of the majority of the present family members to avoid further conflict and emotional distress. The correct answer is A. Seek verifiable documentation of the deceased's wishes, engage in facilitated communication with all involved family members, and consult legal counsel if significant legal ambiguity or conflict persists regarding disposition authority and the weight of prior verbal expressions. Explanation. This scenario presents a profound ethical and legal challenge for a thanatologist. The core difficulty lies in balancing the deceased's expressed wishes, as communicated by a family member, with the potential for family conflict and the legal requirements surrounding disposition. The thanatologist must navigate the delicate intersection of grief, familial dynamics, and regulatory compliance, ensuring that the deceased's autonomy is respected, while also safeguarding against potential legal repercussions or exacerbating family distress. The deceased's prior communication, while ethically significant, may not hold the same legal weight as a formally documented directive, creating a tension that requires careful consideration. The correct approach prioritizes a structured, legally informed, and ethically sensitive process. It involves seeking verifiable documentation of the deceased's wishes, engaging in open communication with all involved parties, and consulting relevant legal counsel or regulatory bodies if ambiguity persists. This method upholds the principle of respect for autonomy by actively seeking to honor the deceased's expressed desires, while simultaneously adhering to legal mandates and mitigating risks. It demonstrates best professional practice by proactively addressing potential conflicts and ensuring that decisions are made on a solid foundation of evidence and legal understanding, thereby protecting both the deceased's legacy and the thanatologist's professional integrity. An incorrect approach that relies solely on the verbal assertion of a family member without seeking corroborating evidence or legal clarification fails to adequately address the legal framework governing disposition. This could lead to legal challenges from other family members or disputes over the handling of the remains, potentially violating statutes related to consent and authorization for funeral arrangements. Another incorrect approach might be to immediately dismiss the deceased's wishes based on the family's current emotional state or perceived conflict, thereby disregarding the ethical imperative to honor autonomy and potentially causing further distress to the grieving family. This approach prioritizes expediency over ethical obligation. A third incorrect approach could be to unilaterally proceed with a disposition that aligns with the family's immediate desires without fully exploring or verifying the deceased's prior expressed wishes, thereby potentially acting against the deceased's known intentions and creating an ethical breach. Professionals should employ a decision-making framework that begins with identifying the core ethical and legal principles at play: autonomy, beneficence, non-maleficence, and justice. This is followed by gathering all relevant information, including any written directives from the deceased, statements from family members, and applicable laws and regulations. Next, potential courses of action are evaluated against these principles and legal requirements. Open and transparent communication with all stakeholders is crucial, as is seeking expert advice, legal or ethical, when faced with complex or ambiguous situations. The final decision should be documented thoroughly, reflecting the process undertaken and the rationale behind the chosen course of action. Question 17. The review process indicates a thanatologist is providing support to a client whose family has recently experienced a death. The client's cultural background is significantly different from the thanatologist's own, and there are observable differences in how the family is expressing grief and engaging in mourning rituals. The thanatologist is unsure how to best proceed to ensure culturally sensitive and effective support. Which of the following represents the most appropriate initial approach? Option A. Proactively inquire about the client's cultural beliefs and practices related to death, grief, and mourning, and integrate this understanding into the support plan. Option B. Avoid discussing cultural differences to prevent potential misunderstandings or offense, and focus on universal aspects of grief. Option C. Rely on pre-existing knowledge or stereotypes about the client's cultural group's mourning practices to guide interventions. Option D. Assume that the client's grief experience will align with general models of bereavement and offer standard support interventions. The correct answer is A. Proactively inquire about the client's cultural beliefs and practices related to death, grief, and mourning, and integrate this understanding into the support plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a thanatologist to navigate deeply ingrained cultural beliefs about death, grief, and mourning, which can significantly differ from their own or the dominant cultural norms. Misunderstanding or disrespecting these beliefs can lead to profound distress for the bereaved, damage the therapeutic relationship, and undermine the effectiveness of support. The need for cultural humility and sensitivity is paramount. Correct approach analysis. The correct approach involves actively seeking to understand the client's cultural background and its influence on their bereavement process. This includes recognizing that nonverbal cues, expressions of grief, and desired rituals may vary widely. Best professional practice, as guided by ethical principles in thanatology and general counseling frameworks, mandates a client-centered approach that prioritizes the client's cultural context. This aligns with the ethical obligation to provide culturally competent care, ensuring that support is respectful, relevant, and effective. It avoids imposing external frameworks and instead works collaboratively within the client's worldview. Incorrect approach is analysis. One incorrect approach involves assuming that grief expression is universal and applying standard Western models of grief without inquiry. This fails to acknowledge the diversity of human experience and can be perceived as ethnocentric and dismissive of the client's cultural identity. Ethically, this violates the principle of respecting individual differences and can lead to ineffective or even harmful interventions. Another incorrect approach is to avoid discussing cultural differences altogether, fearing missteps. While well-intentioned, this can result in a superficial level of support that fails to address the client's core needs as shaped by their culture. It represents a failure to engage in the necessary work of cultural competence and can leave the client feeling misunderstood or unsupported in crucial aspects of their grief. A third incorrect approach is to rely solely on stereotypes or generalizations about a particular culture's mourning practices. This is a form of cultural bias that can lead to inaccurate assumptions and inappropriate interventions. It is ethically unsound as it treats individuals as representatives of a group rather than unique persons with individual experiences within their cultural context. Professional reasoning. Professionals should employ a decision-making process that begins with self-awareness of their own cultural biases. This is followed by a commitment to ongoing learning about diverse cultural perspectives on death and dying. When working with a client, the primary step is to create a safe space for open dialogue about their cultural background and how it informs their grief. Active listening, asking open-ended questions about their beliefs and practices, and demonstrating genuine curiosity are crucial. The professional should then adapt their support strategies to align with the client's expressed needs and cultural preferences, always prioritizing collaboration and respect. Question 18. The analysis reveals that individuals facing death often employ a range of coping mechanisms. Considering the ethical and professional guidelines for certified thanatologists, which approach best supports an individual who expresses a desire to process their emotions and find meaning in their experiences, rather than simply avoiding distress. Option A. Encouraging them to suppress their negative emotions to maintain a positive outlook for their remaining time. Option B. Primarily offering spiritual comfort and guidance, assuming this will address all their emotional and existential needs. Option C. Implementing distraction techniques and focusing on positive affirmations to divert their attention from difficult thoughts and emotions. Option D. Facilitating open dialogue about their feelings, exploring existential questions, and validating their experiences to help them find personal meaning and acceptance. The correct answer is D. Facilitating open dialogue about their feelings, exploring existential questions, and validating their experiences to help them find personal meaning and acceptance. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of individual differences in coping with terminal illness, moving beyond generalized assumptions. Professionals must navigate the ethical imperative to respect patient autonomy while providing evidence-based support. The regulatory framework for Certified in Thanatology, CT, emphasizes person-centered care, informed by principles of dignity, respect, and the alleviation of suffering. The correct approach represents best professional practice because it acknowledges the multifaceted nature of coping mechanisms and the importance of tailoring interventions to the individual's unique psychological, social, and spiritual needs. This aligns with CT guidelines that advocate for a holistic assessment and the collaborative development of a care plan that respects the individual's lived experience and preferences. It prioritizes active listening, validation of feelings, and the facilitation of self-expression, empowering the individual to engage with their end-of-life journey in a way that feels meaningful to them. An incorrect approach that focuses solely on minimizing distress through distraction fails to acknowledge the potential therapeutic value of confronting difficult emotions and existential concerns. This can be ethically problematic as it may inadvertently invalidate the individual's experience and hinder their process of integration and acceptance. It also risks imposing a professional's own comfort level with difficult emotions onto the patient, which is contrary to person-centered care. Another incorrect approach that emphasizes only spiritual solace without considering the individual's broader psychological and social context can be equally problematic. While spiritual support is vital for many, it may not be the primary or sole coping mechanism for all individuals. Failing to explore other avenues of support or to assess the individual's receptiveness to spiritual guidance can lead to a care plan that is misaligned with their actual needs and preferences, potentially causing further isolation or distress. The professional decision-making process for similar situations should begin with a thorough, non-judgmental assessment of the individual's current coping strategies, their perceived strengths, and their areas of struggle. This involves active listening, open-ended questioning, and observation. Professionals should then draw upon their knowledge of various coping theories and interventions, considering their applicability within the CT ethical and regulatory framework. The next step is to collaboratively discuss potential support strategies with the individual, respecting their autonomy and preferences. Finally, ongoing reassessment and flexibility in adapting the care plan are crucial, recognizing that coping mechanisms can evolve throughout the dying process. Question 19. Risk assessment procedures indicate that a patient diagnosed with a terminal illness is exhibiting significant signs of anxiety and withdrawal. Considering the impact of terminal illness on mental health, which of the following stakeholder perspectives best guides the professional's immediate response and subsequent care planning? Option A. Focusing primarily on managing the patient's physical symptoms of anxiety, such as restlessness or sleep disturbances, with the expectation that symptom relief will alleviate their mental distress. Option B. Prioritizing a comprehensive assessment of the patient's emotional and existential distress, collaboratively developing a personalized support plan that may include psychoeducation, coping strategies, and referrals to mental health specialists, while respecting the patient's autonomy and involving their support network as appropriate. Option C. Implementing a standardized grief counseling protocol immediately, assuming the patient is experiencing a predictable emotional trajectory and requiring a structured intervention. Option D. Encouraging the patient to suppress their feelings of anxiety and withdrawal to maintain a positive outlook, emphasizing the importance of stoicism in the face of adversity. The correct answer is B. Prioritizing a comprehensive assessment of the patient's emotional and existential distress, collaboratively developing a personalized support plan that may include psychoeducation, coping strategies, and referrals to mental health specialists, while respecting the patient's autonomy and involving their support network as appropriate. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of the psychological impact of a terminal diagnosis on an individual, while also considering the legal and ethical obligations of a professional in the field of thanatology. The core challenge lies in balancing the patient's immediate emotional distress with the need for comprehensive support that respects their autonomy and dignity. The professional must navigate the complexities of grief, anxiety, depression, and existential distress that often accompany a terminal prognosis, ensuring that interventions are both compassionate and clinically sound. The correct approach represents best professional practice because it prioritizes a holistic and individualized assessment of the patient's mental health needs. This involves actively listening to the patient's concerns, validating their feelings, and collaboratively developing a support plan that addresses their specific psychological, emotional, and spiritual distress. This approach aligns with ethical guidelines that emphasize patient-centered care, beneficence, and non-maleficence. It also acknowledges the professional's role in facilitating coping mechanisms, providing psychoeducation, and connecting the patient with appropriate resources, such as mental health professionals or support groups, thereby promoting the patient's well-being and quality of life during their remaining time. An incorrect approach that focuses solely on symptom management, without exploring the underlying existential or emotional distress, fails to address the root causes of the patient's mental health challenges. This can lead to superficial interventions that do not provide lasting relief and may even be perceived as dismissive of the patient's experience, violating the ethical principle of respecting the patient's dignity and autonomy. Another incorrect approach that involves imposing a specific therapeutic model without considering the patient's preferences or cultural background is ethically problematic. This approach disregards the principle of informed consent and can alienate the patient, hindering the therapeutic alliance and potentially exacerbating their distress. It also fails to recognize the diverse ways individuals cope with terminal illness. A further incorrect approach that neglects to involve the patient's support network, where appropriate and with the patient's consent, can isolate the individual and overlook crucial sources of comfort and assistance. This oversight can lead to a less effective support system and may not fully address the multifaceted impact of terminal illness on mental health. The professional decision-making process for similar situations should involve a systematic assessment of the patient's emotional state, a thorough understanding of the psychological stages of grief and dying, and an awareness of available resources. Professionals should employ active listening, empathetic communication, and a non-judgmental attitude. They must also be adept at recognizing when to refer to specialized mental health services. The process should always be guided by the patient's expressed needs and wishes, ensuring that all interventions are collaborative, respectful, and aimed at enhancing the patient's comfort and dignity. Question 20. Strategic planning requires a thorough understanding of how an individual's existential fears surrounding mortality can manifest and impact their overall well-being. When a client expresses significant death anxiety, what is the most ethically and professionally sound approach for a certified in thanatology professional to adopt? Option A. Immediately prescribe relaxation techniques and mindfulness exercises to manage the immediate symptoms of anxiety, assuming that addressing the physical manifestations will resolve the underlying fears. Option B. Focus solely on practical end-of-life arrangements and legal documentation, as this can provide a sense of control that may alleviate anxiety without directly confronting the emotional aspects. Option C. Conduct a comprehensive assessment to understand the specific nature of the client's death anxiety, explore its potential origins, and collaboratively develop a personalized intervention plan that may include psychoeducation, therapeutic techniques, and existential exploration. Option D. Share personal anecdotes and philosophical beliefs about death and dying to provide the client with a framework for understanding their anxieties, guiding them towards a particular perspective. Correct answer is C. Conduct a comprehensive assessment to understand the specific nature of the client's death anxiety, explore its potential origins, and collaboratively develop a personalized intervention plan that may include psychoeducation, therapeutic techniques, and existential exploration. Explanation. This scenario is professionally challenging because it requires navigating the complex emotional landscape of death anxiety within a professional context, while adhering to the ethical and regulatory standards of the Certified in Thanatology, Death, Dying, and Bereavement (CT) framework. The CT designation implies a commitment to evidence-based practice, client-centered care, and professional conduct that respects individual autonomy and dignity. Death anxiety is a multifaceted phenomenon that can manifest in various ways, impacting an individual's psychological, emotional, and even spiritual well-being. Professionals in this field must be equipped to recognize, understand, and respond to these anxieties in a manner that is both therapeutically effective and ethically sound. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the client's death anxiety. This involves understanding the specific nature of their fears, their cultural and personal background, and their coping mechanisms. It then moves to developing a tailored intervention plan that may include psychoeducation, therapeutic techniques, and the exploration of existential concerns. This approach aligns with the CT's ethical guidelines, which emphasize competence, beneficence, non-maleficence, and respect for client autonomy. By focusing on the client's unique experience and employing evidence-informed strategies, the professional acts in the client's best interest, aiming to alleviate distress and promote a sense of peace or acceptance. An incorrect approach that focuses solely on immediate symptom management without exploring the underlying causes of death anxiety would be ethically problematic. This could lead to a superficial resolution of distress, failing to address the deeper existential or psychological roots of the anxiety. It might also be seen as a failure to provide competent care, as it bypasses a thorough assessment and a holistic intervention. Another incorrect approach, such as imposing personal beliefs or values onto the client regarding death and dying, represents a significant ethical failure. This violates the principle of client autonomy and can be deeply damaging, particularly when dealing with sensitive issues like death anxiety. Professionals are expected to maintain objectivity and respect diverse perspectives, not to proselytize. A third incorrect approach, neglecting to involve the client in the decision-making process about their care, also constitutes an ethical breach. This undermines client autonomy and can lead to interventions that are not aligned with the client's wishes or needs, potentially causing further distress. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough and sensitive assessment of the client's death anxiety, considering its origins, manifestations, and impact. Second, Engage in collaborative goal setting with the client, ensuring their active participation in defining desired outcomes. Third, develop an individualized intervention plan based on evidence-informed practices and the client's specific needs and preferences. Fourth, continuously monitor the client's progress and adjust the intervention plan as necessary, maintaining open communication. Finally, always operate within the ethical and regulatory boundaries of the CT certification, seeking supervision or consultation when encountering complex or challenging situations.